We need legislation that will help support our efforts out in the field to save lives. If the state of Texas was to pass laws that support the requirement of updating ODMAP, whether manually or automatic through a record management system, it would provide first responders throughout the state a real-time snapshot of the situation in the ODs and the opioid crisis as it exists in this state today. The information that we can garner from this platform when we share all this information across the entire state is immense. We can make decisions on the type of units that are going and responding to these calls, the kind of social services that would be best served to this community, and also identify these trends as they're emerging in other parts where we hadn't had ODs before. A lot of this comes down to sharing this information across a number of platforms. ODMAP does that with us. It's vital that leaders both locally and at the state level come together on this point. We need legislation that will help first responders report these overdoses in a platform that can be seen across the state so we can share data in real time. One of the biggest questions we're asked is, how much does this program cost? What does it take for our organization to participate in this? And the answer is, it's already funded by the federal government. This is a platform that's offered to any participating agency free of charge. There's different levels of participation and administration. And the only cost that we've incurred is a small one-time setup fee on our record management vendor side. What we've seen with the other states that have legislation on the book is that they're reporting these OD cases in real time, and they're able to make real-time decisions in the streets that impacts the ability to save lives and reduce this in the community. If your community is facing opioid crisis like many of our communities are, ODMAP is a very easy to use, user-friendly, very cost-effective way to provide a risk management tool to your team. Our success would be measured in more participants being part of this program, whether that's through legislative increases and enhancements, or whether that's through voluntary adoption of the program. We want to see more people using this software. It would help us, it would help you, and in the end, it will help residents.